Good morning, dear friends. We're beginning our panel on communication. I'm Mr. Krutchinin, and I'm contributor to the communication strategy design targeting people 65 plus. In the beginning, I'd like to give the floor to Elena Titova. She's a journalist, chairman of the Central Council on the Assistance to Young People with Disability. She's one of the initiators of the project to manage people with a disability. She'll talk about easy to understand or plain language as part of barrier-free environment. Good morning, dear participants. Thank you for inviting me. Even though my activities and my organization's activities relate to disabled people participating at this forum for the second day in a row, the topic of older people also fits well with what we do as part of our main operations. You promised that you will play my video. Yes, as soon as you give us a go, we will run it for you, and there'll be a brief Q&A session at the end. So let's talk about the plain or easy-to-use language. It's relatively new to Belarus. Perhaps not so new for other countries. In other countries, it began maybe 15, 20 years ago. In Belarus, we embraced this topic only in 2017. This is a barrier-free communication to ensure access to information for people with cognitive dysfunction or cognitive impairments. So now let's have that video, and then I'll start my presentation.
Многие люди при чтении текста не могут понять его смысл. Например, люди с инвалидностью, пожилые люди, иностранцы. Ясный язык помогает создать доступный текст. На ясном языке должны быть написаны законы, банковские и правовые документы, маршруты транспорта, карты, меню и другие тексты. Есть международные стандарты ясного языка. Это правила создания текстов на ясном языке. Привлекайте экспертов к оценке текстов. Они проверяют, легко ли читать текст. Главные эксперты — люди с умственными ограничениями. При написании текстов используйте короткие и простые слова. Поясняйте трудные слова. Избегайте сокращений. Используйте всегда одно и то же слово для обозначения того же самого предмета. Выбирайте положительные формулировки. Используйте арабские цифры. Вместо больших чисел используйте слова «много» и «мало». Пишите номера телефонов с пробелами и дефисом. Используйте крупный простой шрифт. Логотип ясного языка рядом с текстом означает, что текст написан на ясном языке. Ясный язык — это доступная информация и самостоятельные решения. Ясный язык просто для каждого.
Да, отлично. Немножко подвисало видео, но я думаю, что...
The video was a bit glitchy, but I hope you understood everything and everything was clear to you. So I'm sharing my presentation with you, and I'm beginning my narrative. I'll try to be brief using easy to follow language. So once again, what is easy to read language? This is information written in simple and easy to understand language. It can be used both verbally and in writing. You can use it to teach or to receive information in different life situations. This language adapts itself to structure, syntax to make it easy to understand. Making adaptations to the easy to follow language needs to have a certain boundary, but you have to really feel that boundary. The general principle for the plain language is you can make it simple as long as it does not distort or compromise the meaning. What are the target groups for this plain language? These are all people who have difficulty reading or writing or understanding oral or written language. These are people with disabilities, foreigners, and the elderly. Examining the target audience is the key objective of a specialist who translates the content into the plain language. Areas of application, the scoping. It's very wide. It could be public ads, manuals, leaflets, magazine articles, banking documentation, legal documentation. So it's everything revolving around us in life. And we want to obtain this information in the plain language. It could be a restaurant menu. Next area of application is the internet. We've been hearing for 2 days already about the significance of teaching older people on how to use various gadgets and their features. So about the internet, you need to have easy to understand navigation system, plain title and easy search function. And communicating with the target audience would help you work out the best solution. Video materials, they include speech, talks, visual images, motion, music, and graphic elements. Translating into easy-to-read language. Stages. Text can be written in the plain or easy-to-read language right off the bat. Or you could have regular text that requires translation into the easy-to-read language based on the needs of the target audience. The first step is to understand who the target audience is, who you're writing for. What are the strengths and weaknesses in terms of reading of these people? Once the text is compiled, you need to proofread it with specialists. And proofreading needs to be aimed at seeing whether it's easy to read. Later during the presentation, I will tell you about the principles already in existence in Belarus. When converting into the easy-to-read language, you need to be mindful of the barriers for receiving information. That includes perception, understanding, knowledge, and experience. These factors go a long way in receiving information. So if first thing you need to do is to analyze communicative needs of a person. I think that's pretty obvious. So that was the theory. Now let's talk about actual experience. Let's say we're starting a club for the adults to teach them how to use Viber. This expert comes from the internet. Now let's see how it's going to sound when interpreted into the easy-to-read language. Can you see it? Yes. Now you can read and see this is a fragment from a new booklet translated into the easy-to-read language for the disabled people on how to use the Viber. You can make comparisons, and I'm pretty sure you are going to prioritize the text with the yellow background. That is to say, if you do something for disabled people or for those with difficulties, we automatically involve a wider readership. Another case. Sorry, it doesn't seem to switch. Another example. It talks about medical examinations that disabled people have to take to receive what we call recommendations for employment, to determine whether they need support or not. This also goes for a lot of older people who, as they age, apply for disability benefits. So on the left, you see expert from a real document, very formal. And on the right-hand side is the transformation of that text into the plain to read language. I don't know if our foreign colleagues are able to follow, but I'm pretty sure they know what easy to read language is. Also mind the setup, the layout. The font size on the left-hand side is very small. It's hardly legible, difficult to perceive visually. In contrast, in the easy-to-read language, you use special fonts with different spacing and layout specifics. They can also contain various icons and images. With the onset of the pandemic, the situation that everyone is facing now, information emanating from television or healthcare system, this information sometimes leads to panic, and it's presented in a very medically heavy language. Therefore, we decided to translate this medical information into a plain language about coronavirus, how to behave, how to treat it, and this information should be available electronically very soon. Some information about legislation. How is the easy-to-read language supported in legislative terms, in terms of policy? Our organization managed to secure the presence of this language in the copyright and related right law, meaning that if there are some texts to be translated into the plain language, by law, we don't need to get approval of the author, which is important. It's the same with the Braille language. So the adoption of the law on disabled people and their social integration is pending now, and it provides definition of the plain language, and it is one of the means of communication. It's incorporated in that law. And also under the project supported by the German government, we applied to the National Belarusian Institute of Standards and Certification, and they created a state standard, a dedicated state standard on the easy to read language with contributions and comments from subject matter experts. So the target group is people with cognitive disorders, speech impediments, memory lapses, hard of hearing, dementia, brain injuries, or strokes. So this language is to be used to adjust public transportation itineraries, city navigation maps, cafe menus, electronics manuals, medical manuals, which is especially important for the elderly, newspaper articles and magazines, and a lot of other stuff. The standard does not establish any specific forms, illustrations, or images to design information. That's about the standard. Now, I'd like to share with you the product of our organization. I'm very sorry to cut you short. Only 1-2 minutes left for you. I'm very sorry. Yeah, I'll make it. I just wanted to say that our professionals are the only ones with knowledge and ability to convert text into easy to read text. We also have proofreaders from amongst disabled persons. We arrange trainings, seminars, and continuing education courses. And we're also establishing networking, a partner network in Belarus, so that we jointly create conditions, create enabling environment for the disabled people to perceive information in easy to understand language. Thank you very much. I'm pretty sure there will be questions later on. Now I'd like to give the floor to Alexandra Schetkina, a journalist, a creator of the Alzheimer network in Russia, a founder of the charity on dementia and caregivers affected by this disease. She will tell us about best practices in communication campaigns. Hi, everyone. I'm so thrilled. Such a great presentation about the easy to read language. And indeed, dementia is a huge problem, and you want to help people in initial stages in terms of orientation, getting their bearings in shops, So now I'm going to think about how to adjust my website so people with dementia are able to follow what's written on it. I will now tell you about our experience of tackling dementia. The problem is huge with different implications, financial implications, care implications. We're trying to work with it, but since I am a journalist, it is the word and the pen which is my weapon. You can see it all right? And I'm scrolling down and you can see it, yeah? Very good. So Alzheimer Russia or Alt Rus Foundation was established in 2019 with psychiatric gerontologists to raise awareness about dementia and helping people who encountered this scourge. I'm bringing personal experience into this foundation. It happened in my family, so I don't want people who came across this to endure such hardships and misery and stress that we all experienced. We are members of Alzheimer's Disease International and Dementia Friends, and we are the only not-for-profit organization that embraces this topic in such a comprehensive way in Russia. All our activities and campaigns are united by the unifying motto of Together Against Dementia. Dementia patients are invisible to the society. They don't go to cafes or to the movies as a family. If you have dementia, you typically stay at home and you don't have a lot of things to do. There is no adaptive environment for you. We also raise awareness of the society about signs or symptoms of dementia. We teach them to bring their older folks to doctors if they see that memory is failing for early diagnostics. So it's also prevention and early detection. That's what we're after. And healthy aging, risk reduction. We want to do more for families with dementia. Our tools are social media, mass media, conferences, roundtables, meetups with ministers, officials. This program, Together Against Dementia, has discussions with the government representatives, experts. So we try to engage in constructive dialogue with the government. And there is also a run called Running Against or From Dementia, very small marathon. A few other outputs: writing books on dementia. Most of these are translations. In fact, there is very scarce information about dementia and how to cope with it in Russia. There are few books available online, but if you don't know about them, you will not find them. So what we try to do is to devise books written in plain language about dementia, their translations. Next year, we will publish a book on emotional burnout of caregivers. We're also looking on publishing a book for children, where we will tell them what's wrong with their grandmother or grandfather and how to deal with it. So it's something that we want to distribute through libraries or other outlets. And if you don't know about our foundation, you should be able to locate this book in your local library to find information about this disease and to take those crucial initial steps when someone close to you exhibiting symptoms of dementia. Books are not easy to publish, so we're also into fundraising activities. Informing public via mass media. I love appearances on radio, giving interviews. We now have long-standing ties with different broadcasters where we cover different topics about support or lack of support from the government. We talk about international experience. We talk about ethics, how to communicate, how to talk with dementia patients, and elder abuse is another topic, how to tackle that. So a lot of different acute topics we are covering to bring this topic to the foreground. So I make a lot of appearances and interviews every week where I try to inform social workers who are the first. They're the frontline people when it comes to interaction with dementia people. So we organize such training sessions in a variety of towns and localities. The COVID has come to show how hard it is to talk to dementia people when they don't have any relatives. So this problem has been exposed starkly. I also have meetings with officials, for example, with top official from Astrakhan region. Next year, we're planning to open a branch of our foundation in the Astrakhan region, which is a huge step forward. Russia is a big country with different regions with different legislation, so it's important to be able to organize assistance on the ground. We run info campaign in social media. These are postcards that an idea we stole from our colleagues from abroad. In September, we run the Dementia Awareness Week when we publish such postcards. These are wrong postcards. It says here, hello from St. Petersburg, whereas you see the Kremlin in the background. And we get some angry responses and critique from people. Hey, you got it all wrong. But this is to raise awareness, and we explain to them the message that we are trying to deliver here. We also follow WHO recommendations, and we have such cards that provide simple ways to reduce stress or get rid of bad habits. So we have a ton of such cards pursuant to WHO recommendations. This really attracts attention of people, and young people in particular. These are grandchildren who may be now in position to detect some of the signs, some of the risks that their grandparents may be exhibiting. So this is an integrated approach covering a wider audience. And this is our Violet Run. This year it was an abridged version because of COVID. We also contribute to Moscow Run, which is much bigger with thousands of runners. This year they canceled this bigger marathon, so we arranged an abridged version, very small one, where participants took a short run to raise awareness about dementia. We posted pictures on social media. So we try to spread the word in fun ways also. And by this, we're telling people about a horrific problem. We also have a 3-day regional conference on dementia called ALZCON, Alzheimer's Conference. We visit different towns, meet with doctors, and they as experts discuss different aspects of the problem. We have a social blog where we cover communication techniques, care provision. We give tips to caregivers on how to interact with their relatives. There is always a higher level meeting as part of the conference, maybe at the mayor's office, where we discuss ways to improve awareness and prevention of dementia locally. Another thing we're doing is we visit regions when they start special cafes under our mentorship. So this is a good practice, a good groundwork to open a branch later on. So we try to break ice, make acquaintances with the local officials, medical staff, so that later we organize our presence. I think you know about color coding on different diseases. Dementia is a violet color or purple color. So on the Awareness Day, different countries illuminate major landmarks and buildings in a particular color as a sign of readiness to change the situation. So this year, for the first time, the Yeltsin Center has been illuminated with a purple violet-y color. Not only did they light it but they also talked about the dementia. And this has gone viral, generating a lot of feedback. Some people were negative, saying that it's all pointless. But nevertheless, it's a big step forward, and I do hope and looking forward to Ostankino, the Bolshoi Theater, or other buildings in Moscow to join this campaign of illuminating with the purple color to attract attention. Yes, I know, I'm wrapping up. In fact, that's all. We are working for these people. Yes, it's a bad disease. It's a horrible disease, but we need to make everything possible to make these people feel safe. Thank you, Alexander. Let me remind you that we have a chat box where you can post your questions. I, for one, have quite a few questions to Alexander regarding mass media interface, but we'll get to that later. Now it gives me great pleasure to give the floor to Marita Gerwin, a certified, a registered social pedagogue, social teacher. For 20 years, she has been running the specialized organization at Arnsberg. She's an age, she's trying to set and is running an age-friendly foundation. Please, Marita, building communication with people and for people. This is not the first time I'm attending such forums, and I'd like to tell you about Arnsberg. It's a city, it's a town with 40,000 people in the center of Germany. The age of topic is very important for us, has been for quite a while. So I designed this concept where our town is a great place for healthy and active aging. This photograph is a great depiction of what we try to achieve. So communicating with older people and for older people, communication is key to success. The first objective that we set is to bring this topic into public field and to destigmatize aging, make it visible. We want aging to become a common topic of discussion in towns and cities and villages. And of course, we knew that we need to provide examples of how older people are able to plan their own lives and manage their lives. Discuss different topics with the elderly. Ask questions about how they want to live their lives, what their objectives are, what do they want. It was clear to us from the beginning that aging does not mean sitting in a rocking chair. People want to contribute to society as much as possible until the very last day. And a lot of people, older people, told us that it's quite okay to maintain a colorful life until you die. Nobody wants to be on the sidelines on account of getting old. Everybody wants to be in the mainstream. We've run a survey where we asked about a couple thousand older people about how do you want to live when you get old. So we formulated a few policies, a few principles underlying our approach. Direct communication is key to success. Take heed of what people are saying. For this, you need to attend their places of gatherings. You need to talk with them about what worries them, what's important for them, what matters to them. You also need to set up meetings for such people and invite everyone. It's important to set up ties between organizations and people sharing goals. The previous speaker mentioned the importance of digital technologies, plain language, easy to read language. It's also important to not only talk about problems, but also about solutions, and to tell stories, life stories of these people, as it helps in creating empathy and solidarity. The ability to provide narrative or this storytelling was an important tool that helped us get our foot in many doors. And this is how our clowns work. You may have heard about hospital clowns, but these are our humor ambassadors. They find it a lot easier to speak the same language with the elderly. And then the pandemic came. For 20 years, we have been working swimmingly, and then the pandemic threw a wrench in our plans. So we were no longer able to hold meetings or activities. All meeting places were shut down, and there was a spike of misinformation flooding mass media, creating irritation and fear in people, in particular in older people. And it is older people who felt particularly lonely and frightened when lockdowns were introduced. Grandchildren couldn't visit their grandparents anymore. You could not visit care homes any longer. So dementia people had to stay at home all the time. It was indeed an unpleasant situation, but there was no time for grieving. And Arnsberg decided to use available facilities to adapt to emerging circumstances. So we began publishing our own news bulletin. It was a mix of short stories containing info about the pandemic. We said we must not limit ourselves to information only. We need to enlist and engage graphic representations. So we invited an artist who helped make our language, our message, more clear. As you can see, this poor fellow, poor gnome, lost the tip of his head to use it as a face mask. I told you all regular hangouts for older people were shut down and they were put in between four walls, which boded loneliness, loss of outlook, and stress for spouses, for family who had to provide care all by themselves. And there is a short way to depression and domestic violence from here. So we decided to look for ways that would help people retain connections without the possibility to meet physically. And this is where this news bulletin became very important. We issued 78 editions. It was a weekly news bulletin most of the time. And the objective was not simple. It took a lot of volunteers, a lot of resources to make it happen. This is how our bulletin looked. I think you'd agree that it's very attractive, very colorful. You are very eager to take it in your hands. It provided stories about how our hospital clowns worked, how they played music in front of the care homes, trying to provoke discussions with the elderly residing there. So a lot of colors, excellent graphics, all of that help us gain confidence in the eyes of the readership. This news bulletin has also been posted on our website. Next thing we used was the Sicht magazine for all generations. It is funded by the municipality. The magazine comes out online and in paper. This is a quarterly edition with 6,000 copies. It is distributed freely in libraries and bakeries through different outlets. We've been publishing it since 1999. And since we're talking about magazine for all generations, we of course had older people in mind as well. And it is through this magazine that we maintain contacts during the pandemic. We encouraged readers to send us new information. This is how our journal looks. The magazine for all generations. This is a message from the editor's column. As you can see, it is signed, which increases the level of confidence. So we've had infrastructure and facilities, but we needed to look for new ways. This was unprecedented. Never before have we come across such a phenomenon. And those lockdown activities have disrupted the normal life, bringing major changes in the operations of our partner organizations. We were deprived of any possibility to work together offline. Everyone was focused on prevention, on restrictions, and I followed this so sadly because it took us 20 years to set up this communication, and then this virus from out of the blue turned everything upside down. But as I told you, we kept a stiff upper lip. And one of the first decisions we made was to set up a hot telephone line on behalf of the municipality. This gave citizens, city dwellers, a chance to bring their concerns to the authorities. It was a one-stop shop for your complaints, concerns, and worries. More so, thanks to this telephone line, we created jobs for social workers who were fearing layoffs. They could be dismissed, but the telephone line helped them stay in their jobs, and they provide competent replies to a bunch of questions. So we constructed a very good system, and city dwellers got answers from one source with a scientific rationale. It was important to win hearts of people, and we received a ton of calls. Later, you will find a link showing how this line operated. As I told you, we had 20 years of collaboration to rely on, and we decided that younger people needed to extend a helping hand to the elderly and the lonely. And I must say that it was a broad initiative covering 15 districts of Arnsberg and adjacent villages. It was a community effort to fight the pandemic together. How did people help each other? They helped with food deliveries, with hiking, giving car lifts, performances by your house, poetry, coloring stones or rocks, sending videos to the elderly people. And we provided equipment for creating such product. And by fluke, a very prominent German newspaper, Die Welt, came to us offering to start a podcast under the title Everyday Life in Extraordinary Circumstances to support people all over Germany. Die Welt organized the podcast setting, and the podcaster Sonia Gilbert started to discuss with experts how to overcome challenges big and small during such unusual time. So when Sonia Gillard was looking for someone to talk to, if you remember, I was decorated with one of the awards from the municipality. So she came to me as a potential interviewee, and of course I agreed. So one of the initiatives I managed to push forward was a chain of calls. I said, every day I'll be calling 3 people, and then those people will call 3 other people, stirring this wave of solidarity. But pandemic means protection. Initially, face mask were in short supply. So we decided to take action. I know, I'm about to finish. So we gathered women of all ages in Arsberg who were ready to sew face masks. And the way they distributed those is by putting them on plain clothes, on clotheslines. And there were a few other activities, correspondence, clowns by the window, and another touching example. We asked kindergartners and primary school students to write warm messages. This is one of them. This wild lion is going to eat up this virus. For now, we need to stay cheerful, and soon I will visit you as soon as all of this is over. After the mask wearing activity, a new campaign was in the offing. As soon as we got the vaccines, we realized that we need to help people overcome fear of vaccination. So we put up huge posters all over the city with the pictures of city dwellers representing different strata of society under the unifying motto, "We stand for Ansberg, let's vax." Plus there was a vaccination bus driving around the city, so you don't have to visit actual vaccination stations. And a few recommendations to cap it off. If you are arranging networking, of course, we need support personnel. We need people on the ground, and they need to be motivated. Our priorities have shifted during the crisis. That's true. We need to keep looking for new approaches and reconcile our shared goals. Also, roundtables can go a long way in bringing us together. Community activity of everyone, active citizenry will help everyone. I thank you for your attention. I wish you joy, strong motivation, and courage. Courage to start anew. Think about the future and reconnect. Once again, thank you. Now we have the possibility to take questions and discuss matters of interest. First question that we had a pre-planned question for Marita. Here it goes. We know that there is the Elder Council that you're running. So what objectives does it have? What functionality does it have? It was a very tough situation. Of course, members of the council are old themselves, which means they fell under the vulnerable group. They didn't know what to do. They were confused. It was chaotic and initially, but fortunately, we started to organize ourselves. It was at that time that the first podcast came out, and all 19 members of the council liked my idea of calling 3 people. So every member of the council placed 3 phone calls every day. It was just a chit chat, song singing, having fun. And it is with the Elder Council that we designed the content of our news bulletin. We had sufficient volunteers to help us, but the members of the council were also co-contributors. A question for Elena Titova. In which areas do you think the use of easy-to-read language is most promising in terms of efficiency? Where else can you use it? I think the most important thing is to ask the target audience itself. What are your information needs? I know that sometimes people have difficulty making sense out of medication instructions or how to behave during pandemic in the doctor's office. Especially when it comes to information retention. So a medical area is very important, the medical field. Then Viber. There was a reason why I picked it up. Information about using apps, operating gadgets, navigation through website. It's very important information that must be available in the plain language. I tend to exemplify this by reference to the Braille language. Quite a lot of website now come with a special button, which, if pressed, will help the hard of the visually impaired to increase the font size or to hear some tone. And the same principle should apply to the easy-to-read language. We must design such a button so that if you are on a website of a social support center, local social support center, the information there is very dry, let's put it this way. It's very formal. Yeah, formal and dry. And people are not always able to make out or get senses out of it. So again, we could place a button there to translate the language, the text into easy to read language. Marita, you wanted to add something? Yes. I think this plain language is a very important tool. You need to start from yourself. We always make preparations for our presentations. I knew I could make my presentation in a scientific way, but then we need to be simple. We need to be plain, easy to understand. We mustn't overdo it. And in the similar fashion, we need to be working and talking at a grassroots level. I remember one of the meetings at a municipality where the mayor said, "Dear officials, when you talk to people, use German. Don't use your office language." So many thanks to our colleagues. Mass media language is very hard to understand, and it leads to marginalization of people. That is why our news bulletin has been so popular and in demand, because it was written in language that we use to talk to our neighbors and colleagues. I share all of these points. I do agree that we all need to employ a plain language. I wanted to add an important aspect. I picked it up from yesterday. In all honesty, I had no knowledge about this huge problem, which is the elder abuse. Thanks to UNFPA, we published a brochure called, well, about violence and what you need to do if you're attacked physically, with focus on people with cognitive dysfunction. It's not for reading by such people, which is important, but also for conducting webinars and meetups, which are now being conducted successfully. I know of 10, 15 people with cognitive disorders, where they're taught about how to behave in the context of abuse. I want to bring in Alexandra, a lot of questions for her as well. I'll try to combine them, and I'm pretty sure all of the panelists will be able to add something. About that run, what was all about? Could you tell us more? And my personal question, what barriers did you need to negotiate in talking to mass media, journalists? I'm pretty sure that the second portion of my question is something that other panelists can elaborate on. About this run, the essence of this run was to raise awareness and bring new members. Actually, what we contribute is we add a group of people, a column of people who are colored in purple in amidst a much bigger marathon. And the second part is whoever is ready to join our purple column will be able to collect donations, raise funds throughout the year. And then we use this money. Then we get together and thank everyone. We don't have a lot of money for merchandise. the bulk of the people are running in the purple group, and others are asked to add purple colors as streamers, ribbons, you know. This group wasn't as numerous. About the berries, perseverance and hard work are the key. That's all I can say. Initially, I wrote articles suggesting to mass media representatives that they need to change their language. So I wrote a ton of articles to be later used by journalists. Journalists, what they're after? They're after a hot story, right? They like numbers, statistics. So I tried to be very careful with story writing about dementia. I took special care not to create fear or repulsion, but rather to accept it as something admissible. Some of the journalists turned me down. They didn't find it interesting. But later, as the popularity of the foundation increased, they came to me. And I was like, really? I'm not sure I want to cooperate with you now. Thank you, Alexander. Anybody else? Marita or Elena, about overcoming the barriers? Please. Yes. If you remember, I referred to storytelling. It's a key success factor, if you ask me. We tell stories, family stories, generating empathy about how it is to live with dementia-stricken people, older people. One of the formats that we use is where journalist accompanies a family for the duration of 2 weeks, writing about the chronicles of the family. So I remember one journalist, and she said, you can come every day except Thursday, because Thursday is my chest day. And that changes your approach immediately. That tells you something. And this is how stories come to life. This is what makes them fun. It's not easy to find someone who is willing to open up to you. I remember great stories about a miner who said how tough it was to live in Russia after war, mining for coal. I think it's important now to tell about everyday things. Oh, in those articles, we were able to distinguish or to spot our next door neighbors. I wanted to throw an idea for Alexander: children and dementia. In Germany, there is a special platform on Alzheimer and young people where I had a lot of fun following how you set up this intergenerational interface. Yeah, that's great. Let me add on my topic of the plain language. It's incredible. Since 2017, we've had a lot of attention, a lot of media attention. On a regular basis, we talk to them. At first, there was a bit of misunderstanding and disconnect. They thought that journalists were supposed to write in an easy to read language, but we proved them wrong. and explain that the topic itself is important. You know how I explained it? Let's take ramps. Ramps are crucial for wheelchaired disabled people, but who is using those ramps? It's it's the public, right? Who uses those ramps? Yeah, everyone. The same with the plain language. So if someone overcomes this physical barrier, he or she are no longer a disabled person. Similarly, with people that can get information as soon as they have this access, they become part of the society. So we want this to go beyond the disabled only, and then everyone is involved. And I have one question for everyone. Alexander? No. So here's my question for all three panelists. I recently conducted a focus group for older people on the design of our 65 plus communication strategy. And in all of the focus groups, I had 3 of them, there was only one male, only one man. So when I looked at your presentations on the pictures, I haven't spotted a single man on your pictures. I know that men suffer from dementia as well. Where are they? How come they're not on any of your pictures? What do you think the problem is? No, of course, we have a lot of men, and a lot of men visit our Alzheimer's cafes. Statistically, women are more susceptible to Alzheimer. Then they are also more active. Based on the hotline operations, I can say that it's hard to make people go places, especially in initial stages. You're a protector of your family, and if you suffer, you suffer more than women because you're responsible for this family. And it's more challenging to select an activity for men, because for women, tea drinking, dancing, knitting, embroidery are all part of their life. But for men, it's different. But Alzheimer's cafes are attended by men and women alike. Thank you. Marita? Actually, we made a point of looking for men, trying to drag them out onto the streets for hiking, to go on an outing, on a bicycle trip. There are a lot of times when a husband has dementia, his spouse is very bad about it, feels very bad about it. So if you visit our webpage, you will see how our cooking project is doing, bringing people together. So we set up this shared kitchen where everyone can come, and couples started to come as well. It helped them to communicate, to talk to each other. And then the smaller groups started to form. And from that point on, they started to take joint strolls. I'm really sorry. We're being prompted to wrap this up as we stepped outside the boundaries of our proceedings. I want to thank everyone. We could go on with this discussion for a long time, I'm sure of that, but I really enjoyed talking to you and hearing your great presentations with a lot of value. From now on, I will use the plain language. Yeah, that's the best. Allow me to conclude properly. I visited Belarus twice, met wonderful people, two groups, visited Arnsberg, two groups of people from Belarus. We've had so much in common. We have such great friendship. So I'm very happy to be here. Thank you, Oksana, for inviting me. It's a pleasure. Thank you. From the bottom of my heart, I thank everyone. So we leave this session, yes? Just a second, let me find out what we need to do. Such an excellent forum. Easy to read language, plain language, so fun, so valuable. Are you from Moscow? You can contact Downside Up, where our experts provide training to Downside Up. It's an online training. Great, super. It's an ongoing process. So you can see how much it costs, you know. Because everyone wants to read, but the font size is too small. Yeah, we need to change rooms. We need